Telemedicine, presented by Hanumanth Ravindranath, Joy Nulu, and Eric Ochola. Thank you for joining us today. In this presentation, we will cover the influences and benefits of telemedicine and how it uses electronic communication and software to provide clinical services to patients without the need for an in-person visit. What is telemedicine? Telemedicine is the remote delivery of healthcare services, such as health assessments and consultations, over the telecommunications infrastructure. Telemedicine was first invented for the use of telecommunications infrastructure, telephone, and telegraph. Healthcare organizations use telemedicine for various reasons like medical evaluation, managing chronic conditions, medication management, diagnosis, remote post-hospitalization care, preventive care support, school-based telehealth, and assisted living center support. Healthcare providers use telecommunication technology to provide health services for patients. In the early days of using telemedicine, health professionals used the growing technology to reach patients in the rural and urban areas. Telemedicine has been shown to be safe and a cost-effective way of extending delivery of care. It is led by technical standards and clinical practice guidelines and is supported by decades of research. In our society today, telemedicine is becoming an increasingly important part of healthcare organizations. Monitoring through telemedicine practices is now a reality and a mandatory trend for improving healthcare services, delivering better quality of care, responding to growing care needs, breaking down barriers between towns and hospitals with the lack of specialists, improving patients' follow-up, and, most importantly, reducing healthcare costs. The business problem solved by telemedicine. Number 1. A more convenient and accessible way to provide healthcare. The driving force behind telemedicine is that it is a more convenient and accessible form of healthcare, especially because it addresses accessibility issues and care shortages faced by rural residents. Telemedicine not only solves the typical geographical barriers to care access, but also makes the entire healthcare delivery model more convenient to patients. Number 2. Reduce healthcare costs. In 2015, U.S. healthcare spending increased 5.8% to reach $3.2 trillion, or $9,990 per person. National health spending is projected to grow at an average rate of 5.6% per year from 2016 to 2025, and 4.7% per year on a per capita basis. Most of these costs are unnecessary and avoidable administrative costs. Telemedicine has the ability to cut healthcare spending by reducing issues like medication non-adherence and unnecessary ER visits, and will make typical doctor's visits more efficient. Number 3. Easy access to specialist care. Telemedicine allows a healthcare facility to immediately expand access to niche medical specialists. This not only allows primary care physicians to consult medical specialists, but for patients to see a needed specialist for a rare disease regardless of location. Number 4. Increased patients' engagement. In today's world, patients are living in an increasingly connected environment and are very involved in their care. Telemedicine allows patients to connect with their doctors more frequently in a convenient way. This creates a stronger doctor-patient relationship, making patients feel more empowered to manage their care. Number 5. Better quality care. Telemedicine allows providers to follow up with patients and to continue keeping track of their progress. Telemedicine leads to better patient outcome, whether an extensive remote patient monitoring system is used to watch the patient's heart, or doing a video chat to answer medication questions after a hospital discharge. For instance, in some specialties, particularly in mental health and ICU care, telemedicine delivers a superior product with greater outcome and patient satisfaction. Number 6. Remote patient monitoring. Telemedicine solution that falls into the remote patient monitoring RPM allows healthcare providers to track a patient's vital signs and other health data from a distance. This makes it easy to watch for warning signs and quickly intervene in patients who are at health risk or are recovering from a recent surgery, for example. This type of telemedicine is sometimes called telemonitoring or home telehealth. Number 7. Increased revenue for providers. By increasing patient volume through telemedicine, providers' revenue would also increase. It is convenient for both the patient and healthcare provider, as it allows both parties to provide and receive care from the comfort of their own spaces. Number 8. Improved efficiency. Containing the escalation of healthcare costs is an important reason for adopting telemedicine technologies. According to the American Telemedicine Association, quote, telemedicine has been shown to reduce the cost of healthcare and increase efficiency through better management of chronic diseases, shared health professional staffing, reduced travel times, and fewer or shorter hospital stays, end quote. Number 9. A good solution to the threat of retail health clinics and online-only providers. The competition of retail clinics of Walgreens and CVS are avoided through virtual visits. This removes the inconvenience of long wait times and ensures there is continuity of care for patients. Number 10. Fewer missed appointments and cancellations. Telemedicine help decrease the number of cancellations and missed appointments for physicians. It gives the patients a viable option to get treated even if they are not able to make it to the appointment. Number 11. Expand patient base. This form of care allows healthcare providers to reach patients who they would not be able to treat otherwise. For instance, there are nearly 60 million people who live in rural areas who are unable to access good quality care. Telemedicine allows the providers to access this huge population with little to no overhead. Top telemedicine benefits. The most cited positive elements align with the benefits that telemedicine advocates typically promote. The top 3 from the bar graph above are as follows. Quality of care that is similar to or higher than an in-person visit is 21%. Decrease in travel time and cost to a doctor's office is also 21%. And the ability to enjoy the comforts of home while receiving service is 20%. Of note, upon further research, it was found that approximately 6% of respondents, not included in the metrics above, said they did not perceive any benefits during their telemedical visit. Not needing to arrange transportation to and from appointments is a crucial benefit for patients living in rural areas or without ready access to modes of transport. Currently, telemedicine adoption is higher among rural hospitals than urban or suburban ones. In addition, increased offerings from government organizations such as the U.S. Department of Veterans Affairs promises to reach even more patients who have trouble physically getting to the care they need. Government's impact on telemedicine. Number 1, state licensing. Most states require healthcare providers to be licensed to practice in the originating site's state. According to an update from Federation of State Medical Boards in January 2015, 47 state boards require physicians to be licensed in the state where the patient is located, and only 13 state boards issue a special purpose telemedicine license for telemedicine practice across state borders. As long as the referring physician is licensed, many states make exceptions for physician-to-physician consultation. Number 2, HIPAA compliance. Patient privacy is a major concern for telemedicine. Telemedicine providers must guarantee the same level of privacy assumed in a physical doctor's office before patients virtually connect with the provider. HIPAA encrypted systems do exist, but the Center for Medicare and Medicaid Services has not officially regulated the use of telemedicine communication platforms. Number 3, fraud and abuse. Under the anti-kickback statute, it is illegal to knowingly pay, offer, or solicit referrals or services reimbursed by CMS. Given that telemedicine historically involves sharing equipment or products across unrelated health entities, providers must be careful not to misalign incentives. Telemedicine may be exempt under certain safe harbor laws, but until the laws are made clearer, providers must tread carefully. Number 4, parity law. Under parity law, telemedicine reimbursement varies state by state. The ACA, however, only implemented telehealth at the federal level through Medicare in selected circumstances. The power to determine which, if any, telehealth services is covered by Medicaid still remains largely within the power of individual states. Reimbursement parity laws. Telemedicine parity laws require private payers in the state to reimburse the same way they would for in-person medical treatment. The number of states with telemedicine parity laws has doubled in only the past 3 years. With an additional 8 states that have parity laws pending, telemedicine parity for private payers will likely be a nationwide phenomenon in the next few years. State coverage of telemedicine. More than 40 state Medicaid programs reimburse for some form of telemedicine, but these reimbursement policies vary widely from state to state. 22 states plus the District of Columbia have full or partial parity laws that require private insurers to reimburse for telemedicine. At the federal level, Medicare reimburses for telemedicine, but only under eligible conditions.
There are 4 types of telemedicine identified. 1. Live video conferencing. 2. Store and forward or asynchronous video. 3. Remote patient monitoring. 4. Mobile health or mHealth. Live video conferencing. This type of telemedicine is used by patients and healthcare providers to interact in real time. It provides transmission of motionless images and text between 2 locations. Store and forward or asynchronous video. This is used to record health history through an electronic communication system to health providers for treatment purposes. Remote patient monitoring. This allows healthcare providers to track patients from home using different medical devices. Mobile health or mHealth. This is a mobile communication devices like smartphones, tablets, software application for devices, and computers. They are used to access clinical information. Telemedicine services delivery. Telemedicine services are delivered through different means. The following are the means through which it is delivered: HIPAA compliant video, eligibility verification, electronic health record integration, mobile app for patients, built-in support. Confidentiality is an important issue with HIPAA compliant video because not all video connections are properly secured to provide patients with full confidentiality protection required by HIPAA. Due to the following reasons, healthcare providers prefer the purpose-built telemedicine technology over consumer-grade video conferencing. Eligibility verification. This is a means of reassuring the healthcare providers that their services will be reimbursed. So the software is used to verify payment eligibility when appointment is scheduled. Electronic health record integration. This creates an easy way of adding video visits to the mix without additional friction. Mobile app for patients. With this app, providers are sure that patients are getting the appropriate care they need, no matter their location. Built-in support. Due to the difficult nature of some softwares, practices ought to choose technology that includes in-app support for real-time issue resolution to avoid difficult issues. How can providers acquire telemedicine? A provider can acquire telemedicine solution by being licensed in the state where their patients are located. Telemedicine software is the platform used by providers to connect with patients and share video and images. Health information leaders on telemedicine. The following explains why providers, lawmakers, insurers, and customers are involved in telemedicine. Increased revenue, scheduling flexibility, improved patient health outcomes, improved work-life balance, protection from competition, happier employees, fewer no-show and last-minute cancellation, reimbursement for follow-ups. Increased revenue. Video visits are more efficient than in-person ones. More patients could be attended to at the same time by a provider. Scheduling flexibility gives practices the option to offer extended hours or even weekend options without requiring the physical office to be staffed. Improved patient health outcomes. Patients are more likely to do a follow-up appointment if these recommendations can be conducted via video. Improved work-life balance. Providers have the options to work from home through the means of telemedicine or to see their patients outside the traditional office hours. Protection from competition. Here, patients now have more options beside a traditional physician practice for care. Patients can choose between retail walk-in or standalone urgent care operations. Happier employees. Video visits make things more efficient by removing the administrative overhead of in-person visits. Fewer no-show and last-minute cancellation. This is a profit drain and a time wasted for medical practices. Telemedicine helps in eliminating many of these factors that can cause such. Reimbursement for follow-ups. Telemedicine helps revenue grow by turning something that providers often do without payment into a revenue stream. There are three identified users of telemedicine: the patients, providers, and health system. Patients. Telemedicine gives patients the opportunity to receive care without a visit to the doctor's office. Providers. Video visits reduce the time of each encounter. It allows providers to see more patients. This can boost revenue and minimize overhead expenses. Health system. Using telemedicine in healthcare system will reduce wait times for inpatient visits and help keep people with non-urgent conditions out of emergency room, thereby improving the overall health of the public.
Users' interest on telemedicine. Studies suggest that the number of patients taking advantage of telemedical offerings will increase 20-fold over the 5-year period, from 350,000 users in 2013 to 7 million in 2018. Among patients who have not used a telemedicine service, 75% express interest in using one in lieu of an in-person medical visit. 16% of patients would prefer to seek care for a minor ailment at an emergency room if they also had access to telemedical service. Only 2% of patients, only 2% of telemedicine users surveyed said security is their main concern with the telemedical service used. 21% of patients who have engaged in telemedicine visit say the quality of care was similar to or higher than in-person visit. Over one half patients, 56%, don't know if their health insurance covers visits conducted using telemedicine. Now let's look at three pie charts here. Number 1, patient interest in telemedicine. 15% extremely interested, 24% very interested, 37% moderately interested, 18% minimally interested, and 6% not at all interested. Next, patient preferences for telemedicine over ER. The pie chart shows 28% strongly prefer telemedicine, 43% somewhat prefer telemedicine, 12% neutral, next 12% somewhat prefer ER, and 4% strongly prefer ER. Next is impact on patient satisfaction. 11% significantly increases, 56% somewhat increases, 23% no impact, 10% somewhat decreases, and 0% significantly decreases. Telemedicine impact on patients. Remote access to patients. Due to faster internet speeds and updated technology, telemedicine can reach all over the globe, even to doctors and patients in remote areas. Specialty advice. Doctors are also utilizing telemedicine to connect with other doctors to give expert to expert advice and consultation regarding or relating to the patient. The patient, therefore, receives the best care possible from experts. Easy access to care. Telemedicine has allowed for providers to effectively connect with their patients by phone. Patients can now send over vital stats such as blood pressure, numbers, and heart rates quickly to their doctors using new technologies, giving doctors a new method for delivering care for chronic conditions, increasing care quality. Telemedicine can also help in identifying and preventing treatment related errors between clinic visits, thereby increasing the quality of care, promotes continuity of care. For example, a synthesis of evidence from 15 systematic reviews published between 2003 and 2013 demonstrated that heart failure telemonitoring reduced all-cause mortality by 15 to 40% and heart failure-related hospitalizations by 14% to 36%, according to Bola and Kever 2016. Assigning value to telemedicine. Stronger team-based care. Telemedicine allows for clinicians to engage specialists to help with diagnosis of treatments, meaning it can strengthen team-based care. Telemedicine can provide high-quality healthcare services to patients living in rural areas and those with transportation or mobility difficulties. This mode or model has been shown to improve efficiency and lower healthcare costs through fewer hospital admissions, shorter hospital stays, reduced travel times, and improved management of chronic diseases. Its convenience. Telemedicine or telehealth services allows patients to consult with a provider from virtually anywhere in the world, including their home or office. Conclusion. Telemedicine is a new trend sweeping the medical field. As technology advances and at an exponential level, so does the widespread affordability and accessibility to basic telemedical tools. For example, not only do we have the technology for live video telemedicine, but much of the US population has experience using online video chats like Skype or FaceTime, and access to a computer or a mobile device to use them. All the numbers point to this exponential growth of telemedicine. In other words, it's not going anywhere. The global telemedicine market was worth 17.8 billion in 2014, and this is projected to grow well beyond that by 2020. So there's a lot to be optimistic about in telemedicine. A survey of healthcare executives found improving the quality of patient care was the top of their reason for implementing telemedicine, and in another study, respondents say the top benefit was the ability to provide care around the clock. I hope this was educational. Thank you for listening to our presentation. Thank you. Any questions?